Well, welcome everyone. I'm going to go ahead and kick us off. Um, Thank you for joining us for this special presentation. Before we get started, I just want a few housekeeping items. This meeting is being recorded, and we will send out the recording, the links, and the slides within a week. And I am happy to introduce Dr. Sue Keller. Dr. Sue Keller is a graduate of Harvard University, earned her doctorate of dental medicine at the University of Connecticut School of Dental Medicine, and trained at Hartford Hospital CT as a general practice resident in dentistry. Retired from 25 years in private practice, she is an expert in oral health, prevention, and care for dentally anxious adults. She is an oral health prevention champion who advocates for innovative community oral health solutions on a state and national level. Dr. Sue pursues several career passions. She's a community vaccinator all over Massachusetts, a life coach supporting people who want to live the best lives, an oral health prevention coach for groups and individuals, and oral health consultant, patient advocate for patients struggling to navigate complex dental treatment recommendations and care. She is a member of the American Dental Association Institute for Diversity and Leadership class of 2019-2020. She is a Massachusetts grassroots representative for OPEN, which is Oral Health Progress and Equity Network. She's a participant in the National Collaborative for Infants and Toddlers and an oral health representative on the advisory board for the Voices for Healthy Kids Leaders for Healthy Kids program. Dr. Sue lives in Deerfield, Massachusetts, and Hamden, Connecticut, and she is a new empty nester with two young adult children. She enjoys spending time with friends, rowing and sculling, hiking, swimming, playing symphonic double bass, making pottery, performing musical improv. She learned to sail a boat just last year, and she has jumped out of a perfectly good airplane twice. So, Dr. Sue, welcome.
Thank you so much, Andrea, and thank you to the National Collaborative for Infants and Toddlers for having this platform to talk to you all about how to raise a cavity-free kid. A lot of times when we're talking about legislation and policy, we're talking about fixing problems that have already occurred. And I'm hoping that you leave this discussion empowered to actually put prevention into practice in your homes and workplaces, because that's ultimately where we can make a huge, huge, huge difference. Let's go ahead and get started. The slides were always a little tricky for me. There we go. Perfect. And that's my 20-year-old sitting there on his little red thing. And that's me jumping out of a perfectly good airplane. I encourage you to take down my contact information. I definitely want to have you guys put in the chat as I'm talking some of the challenges that you've come across in the 0 to 3, taking care of teeth, any issues that you're having at home, at work, as you're taking care of kids. We're going to have a lot of time to talk about that. I brought a little helper here who we can talk about and do some demonstrations with. And I also have a lot of the things I have that I'm recommending that we can actually show you how to use it if you need any extra support, okay? So these are my top tips for healthy teeth. Nutrition. Feeding babies upon waking is easy. E for eat, A for activity, S for sleep, and Y is time for you. No sugary drinks, few sugary foods, and reducing grazing with regular sit-down meals. Drinking plain water in between, not carbonated water, plain water. After meals, brushing and cleaning teeth at the high chair after meals and snacks. An adult always brushes first, using fluoride and xylitol toothpaste, which creates stronger teeth and less germs. Wiping faces clean as part of the brushing routine, brushing at the same time you do the wiping. Early care mindset matters. Tooth healthy care in all early care settings. Low sugar nutrition, yes to whole fruits, yes to water, no to juice. Cleaning teeth after eating when wiping the face and hands. This is the new mindset that I'm going to throw out there and challenge you all to consider. if we can clean babies' bottoms after diapering, and if we can clean their bottoms and hands after they use the potty as toddlers, we can clean their hands and their face and their teeth at the table when eating. This is a game changer for oral health prevention. Fewer germs. Avoid sharing germs from caregiver to child, and more brushing with xylitol, which creates fewer germs. Making a plan, having a trusted dental home by the first tooth or first birthday, whichever comes first, asking your medical primary care provider to look at your baby's teeth. They can apply a fluoride varnish, they can apply silverdynamine fluoride, and they can make referrals for urgent or routine preventive care. So here's kind of the crux of the whole matter. They're just baby teeth. Why does it matter if they get cavities? They're just going to lose them anyways. And that has been said by adults that I've spoken to my whole career, every socioeconomic status. Everyone says they're just baby teeth. Why do we care? So some basics would just be nourishment for chewing and digestion, but facial development, the bones, the muscles, the sinuses, breathing, airway spaces, which also include the sinuses, communication, facial expressions, and speech, social development, smiling, and belonging. And for the secondary or adult teeth, healthy spacing and having them be decay-free as the adult teeth erupt between ages 6 to 12. What causes cavities? Most people think that it's sugar, and that's only part of the story. And what can you do? So much. With a little knowledge, time, and skill, and not a lot of money, you can raise a cavity-free kit. So here we go. What causes cavities? A plus B plus C equals D. Acid plus bacteria plus carbohydrates equals decay. So decay and cavities are caused by an imbalance of enamel demineralization factors. The enamel is the hardest substance in the human body. It covers the teeth. On the outer surface, there's dentin in between. Then you get to the nerve and the pulp. Acids and acid-producing bacteria and high carbohydrate consumption are all things that promote demineralization of the teeth, of the enamel. It starts off as looking like a little white spot on the teeth, and when it breaks down further, it turns into that brown or black cavitation, which we call cavity, a hole in the tooth, right? So the process of a dental infection is called dental caries. The end result of dental caries is a hole in the tooth, which we call a cavity. So dental caries is an infectious disease. It's caused by bacteria. Those bacteria are transmissible from caregiver to child, parent to child. It is the number 2 most common infectious disease in children in the United States, number 1 being the common cold. So these are factors that are, some of these factors are actually within our control. The other part of this is lacking the preventive or protective and remineralization factors. So having saliva that can adequately buffer acids, adequate hydration, having enough saliva, regular removal of the bacterial plaque and food particles, and then also having the enamel be fortified by fluoride. Those are protective factors, which will combat the acids that are on the teeth. So the more that you eat carbohydrates, the more the bacteria that live in your mouth also eat carbohydrates. The more they do that, the more they do what you do when you eat, and that's kind of poop and pee on your teeth. We call that bacterial plaque. And if we don't remove it on a regular basis, the longer that plaque sits on the tooth, the more damage it does to the teeth. Every time you eat and drink, you will produce bacterial acid for 20 to 40 minutes, which is why it's not enough to brush at the bookends of the day when you get up and when you go to bed, because it's technically when you have the meals that the problems happen. So there's a little juice box over here. These are little baby teeth, and there's the germs that live in your mouth, and they're having a party in there. Okay, that's what you're trying to remove, along with the food particles when you brush baby's teeth at after mealtime. So what can you do? In the chat, I'm going to have Andrea put in a link. It's to my oral health resources. It will have the videos we're watching today, a blog that I wrote about toddler care, but also it has my entire resources for articles that are great, but also specific products that I have used with my patients in my practice, all my children. And I can highly recommend those products. They're not the only products out there, but just those are the ones that I've found very good in my practice. So please take this opportunity to click on that link and save that link for my oral health resources, which I will update periodically. All right. So we're going to try to reduce or eliminate high risk factors for cavities. High risk factors include direct acids in foods, drinks, or from the stomach, such as reflux and vomit. High risks are high levels of acid producing bacteria. High risk is the length of time the acid stays on the teeth. High risk is nursing and feeding babies to sleep once the teeth erupt. High risk is foods and drink high in simple carbohydrates, which cause multiplication of the bacteria and increased acid excretion. More bacteria and more acid because of the simple carbohydrates and sugars. High risk factor is having low saliva or faulty saliva that doesn't buffer acids. And high risk also, and please make a note of this, is asthma inhalers and medicines that dry out the mouth. Asthma inhalers are often have sugar in them to make them taste better for kids. And so the kids are just coating their mouths with that. Now, this is a little bit older than our younger age group, but still super, super important. Any medications that dry the mouth out, and anytime you're using an asthma inhaler, it's extremely important to do some protective measures. With the asthma inhaler, something that can be as simple as rinsing the teeth out, rinsing the mouth out with water after using the inhaler, and that should be standard practice for anyone. Quite bigger question is, why do inhalers have sugar in them? And that's a pharmaceutical company question to ask. But that's when you think about policy and things that you can do with legislation, that is an area you can go after. So nutrition. Let's talk about feeding babies upon waking. It's easy. Baby wakes up, they have something to eat, they nurse, they have their bottle, they play a little bit, they get tired, and you just put them to sleep. When they're sleeping, you have time for you. And this is what Tracy Hogg from the Baby Whisperer calls the easy system. All right. It's easy to do. You know your child's cues. When you wake up, you feed them, they have some activity, they get cranky, you put them to bed. Okay. Kind of like what we do as adults, right? We get up, we have breakfast, and then we do some things, and then we get tired. There are very few people out there who, if I said, hey, let's have you drink 2 or 3 glasses of water, right? Or excuse me, 2 or 3 glasses of milk right before you go to bed. You're going to sleep with a nice full belly of milk. And then also, we're not really going to brush your teeth. So when you wake up in the morning, tell me like what it's going to taste like in your mouth, right? Because that's what we're doing to our babies all the time. And we don't really think about it that much. At nighttime, it's critical because there's less saliva, which means there's going to be more acid damage. And we have milk formula, juice, tea, soda, food left on the teeth at night. You're going to feed that bacteria. They're going to produce acids. They're going to sit on the teeth for hours. And there's going to be no saliva to rinse it out or to buffer it. This is an incredibly high risk of demineralization and decay. Really, really high. Trying to limit sugary drinks. Babies don't need chocolate milk. Babies don't need soda or tea. Really, breast milk, other kinds of milk, and water. However, the teeth do need to be cleaned because all the sorts of milks do have natural sugars in them. Okay. It's important to drink plain water, and a lot of it in between the meals. We also want to have kids sit down when they're eating their meals. So they're not, the toddlers shouldn't be wandering around holding a sippy cup and walking around with that. So we talked about making caring for babies easy with eat first, then activity, then sleep and time for you. Now, if you're already feeding a baby to sleep, if the baby already has picked up that habit, that's a difficult habit to challenge at this point. So you don't want to change it. It'd be great if you could, but most parents aren't going to go through that. But what you can do is you can protect the teeth by brushing them. So you can use a silicone brush, which looks like this finger brush. You might be used to it, having that with your pets. Get that at the veterinarian, but you can get it on Amazon for babies, right? And you just put a little tiny smear of fluoride xylitol paste. You put it in the baby's mouth, and you just go. It's only a couple strokes. The silicone brush is like a nipple, so babies tend to tolerate really easily, and they may not even wake up if you do it. Okay, but super important that if you're going to feed them to sleep, you really do need to clean the teeth afterwards. Otherwise, you're just at a high risk situation. We don't try to minimize giving kids sugary treats, drinks, and dry fruit as well. We don't delay introducing sweets until 2 years or older to protect the teeth, but also prevent diabetes and obesity. There's just a lot of sugar out there that kids just don't need at all. There's not really a benefit to it at them all. But once they get used to it, like particularly if they're given juice rather than water, they start to get used to the juice. They won't tolerate the water as well. And then you've got a high cavity risk situation that can just pretty much destroy their mouth. Just a reminder that 4 grams of sugar is 1 teaspoon of sugar. So a 12-ounce can of Coca-Cola, which has 39 grams of sugar, has literally 10 teaspoons of sugar in a can. So that's the kind of beverages that America is going out and drinking all the time. Some of the Powerade drinks are even worse. And some drinks that you think might be good, like Arizona iced tea, for example, is really, really acidic, lots of sugar. So if we could return all of us to drinking more water in between meals, we'd all be a lot healthier, babies too. Really encouraging using fresh fruit and not juice. I know that on a federal level, juice is considered to be a fruit equivalent for care centers, and I'm going to really strongly discourage any use of juice at all. Use fresh fruit, don't use juice. It's just too dangerous to get started in that habit of wanting those sweetened drinks, and those kids are just bathing their teeth in the juice and the sugar frequently. We want them sitting when they eat. Eating is a discrete time that happens, and then get cleaned up and then move on with the day. We want to end sippy cups by age 12 months. That is a developmental skill to be able to hold a cup, sit and drink with it. We don't want kids wandering around with bottles, particularly bottles that have something other than water in them, because they're just, every time they take a sip, the bacteria eat that sugar that's in there, they make the acids, and the teeth basically sit in acid all day long with those sips. Also, kids walking around with sippy cups are actually a trauma risk. They frequently will walk into the coffee table, fall, hit their teeth, hit their face, and that can cause a really difficult situation. It's not really great when the baby's first visit to the dentist is with facial trauma because they fell and hit the coffee table. It happens all the time. We're going to get you to oral health home, a dental home sooner. So that's not the first experience the baby has. Dry mouth, anytime there's dry mouth, when there's medical conditions or medicines that cause a dry mouth, it is an extremely high cavity risk. Other protective factors like fluorides, more frequent cleaning need to happen. I also want to encourage you to avoid seltzers and carbonated water, as well as soda, because seltzers have carbonic acid in them and also citric acid in them. The only difference with soda is that soda also has phosphoric acid in it, like a Coca-Cola does. And so all those bubbles actually are acid, and they also will dissolve your enamel in your teeth, whether you're a kid or whether you're an adult. So they're not really a healthy substitute for plain water. Water is it. Okay. So when you brush, you're going to brush at the high chair, part of cleaning up from the meals. The adult always brushes first. You know, I'm glad if your child can brush their teeth at age 2, that is amazing. You should continue and give them a brush and let them do that. But I'm sure that if you gave them your toothbrush and said, brush your teeth with those, you wouldn't consider that to be your last brushing of the day, right? So brushing takes skill, takes a little special energy. And even though the baby can put a toothbrush in their mouth and move around, they're not actually brushing their teeth. They're playing at brushing their teeth. So there always needs to be an adult who is doing the brushing in the 0 to 3 age group. In fact, an adult should do a final brushing all the way up through at least age 9 or 10 until kids really do have the hand skills to do a proper brushing. You're going to use fluoride and xylitol toothpaste. The fluoride strengthens the enamels. The xylitol is a 5-carbon sugar rather than a 6-carbon sugar. And the bacteria that eat the 5-carbon sugar, by missing that extra carbon bond, they cannot reproduce and they cannot produce acids in the same way as they can with the regular sugar. Okay. You can even start this earlier than the teeth come in. You can just use part of the washcloth to just wipe down the baby's gums. But you definitely want to be brushing by the time the first teeth occurs. Finger brushes are great. Baby toothbrushes, like this radius brush, very soft, very small head, super easy to use. And sometimes you have to use 2 of them at once. We're gonna have the babies, one finger on the silicone brush on your finger, the other brush in the mouth. And whichever one holds the mouth open better, brush with the other one. Okay. If baby has grabby hands and wants to have something to hold, give them another brush. All right. So it could be two brushes and a finger brush to go on this. But it's super easy. You stand behind the baby, then you're using the same motion that you're using when you brush your teeth. If you're trying to stand in front and try to stick the brush into the baby's mouth, it's really not that effective. It's not comfortable. You don't know how to do that. And it feels awkward. When you come from behind, you're making the same motion that you make for yourself. Super easy to do. You can have one hand on one side of the head, one hand brushing, and you're cradling the baby's head. The high chair is keeping them in good kind of secured. If you try to do it in the bathroom, it's going to be wobbling all over the place. If some parents try to put the kid in the bed and brush, I don't think most people would enjoy being put on their back on a bed and have it brushed up in their mouth. When you're doing it at the high chair, it's just part of the meal. You just had spoons going into the mouth. It's easy just to have the brush going into the mouth at that time as well. Okay. So we have a little video for you to watch, about 30 seconds.
Okay.
Just a little smear right there. Yeah. Yeah, it's time to brush our teeth. Look at this. Okay. Come here. Oh, what are you doing? All done. And then we got some upper ones here. All done. And we're all done.
So poor baby B hadn't actually eaten yet, so he was very kind of hungry and cranky. But you can see when the baby cries, it's actually just as easy to get in and brush with the open mouth as it is with the closed mouth. So when babies are crying, you can get the open part of it. You got to get the biting surfaces, the tongue side, and if they're closed and closing your teeth together, you can get the sides of the teeth. So all those areas are important, and it's really pretty easy to move around and do that.
Okay.
Smear, tiny smear of toothpaste, fluoride and xylitol. See how small the smear is? It is not what the Ultradrink commercials would have us believe with the loop-de-loop and the S loop and all that kind of stuff. It's a tiny bit for babies. When the children get a little bit older and able to spit, then you can have just a pea-sized dab of toothpaste. Okay, super important not to have them swallowing the fluoride toothpaste. Do recommend having them spit without rinsing because it does let the fluoride stay on the teeth a little bit long, but you really want to control the quantity and have it be super small. Okay. So we're going to clean teeth after meals and snacks. When our hands get dirty, we wash them to prevent the spread of germs. When we clean teeth after eating, we remove bacteria and the acids that cause cavities. A reminder to change your brush. It should not look like an elephant has stepped on it. The bristles should always look new, and it's also important to switch out if you've had an illness like a flu. It's important to switch out your bristles. So you don't want to have super worn out bristles. They just don't do the job. Cleaning tongue is important, which you would, in this age group, you can just do with cleaning the brush. Also, you can floss teeth that touch. I recommend using something like this called a gum chuck, which is super easy for parents to use. Also, what used to be called the reach access flosser, I think Listerine takes care of this now. This is done at a 90-degree angle to the handle. It's a toothbrush handle, which adults are really good at using. These are the best way to floss kids' teeth. However, in this age group, I'm just happy if you brush their teeth after meals. Most of the teeth don't even touch until you start to get the 6-year molars in. So maybe the baby molars when they're 2.5 will touch a little bit, and it would be great to floss those if you can. But again, emphasis on brushing after meals and snacks. If you have some extra time and energy, would love to have you floss, but that is not the main focus. When you're talking about early care situations, again, reminding that the low sugar nutrition, saying yes to whole fruits and water, but no to juice, and making sure we clean teeth after eating when we're wiping the face and hands. The new mindset is if we can clean bottoms after diapering and clean bottoms and hands after using the potty, we can clean hands, face, and teeth at the table after eating. It only takes a few seconds. It really does. It's very, very minimal. And it's a makes a huge difference in basically eliminating dental disease. Now, where do those germs come from? Well, when there's no teeth in the mouth, the babies actually don't have the germs that cause cavities. Once the teeth start to erupt, they get those germs from their caregiver, usually the primary parent, but any other caregiver as well. So one of the ways they get that is by tasting the food. So you taste the little food on the spoon and then you give it to baby. You're inoculating the baby with your bacteria, whoever does that is. Pacifier falls on the ground, parents pick it up, stick it in their mouth to clean it off, stick it in the baby's mouth. Now the baby's got your germs. Allowing the baby's fingers into the adult's mouth, and then the baby puts the fingers in their mouth, and also sharing toothbrushes, which is a really unhealthy thing to do. So definitely don't want to do that. The more that we brush with xylitol or rinse with xylitol, the fewer germs that we'll have in the mouth to pass on. It's a kind of an older study, basically moms who chewed xylitol gum 3 to 5 times per day decrease the transmission of carcinogenic or acid-producing bacteria to their 3-year-olds, and there's a marked difference by age 3 of how many bacteria those kids had. So a parent and caregiver are also using xylitol products, whether they're gums or toothpaste or mouth rinses. You can also use it for cooking. It's actually diabetic friendly. You can actually reduce the bacteria in your whole family's mouth. It's a natural sweetener. It prevents cavities because it's a 5-carbon sugar, not a 6-carbon sugar. Bacteria don't reproduce, don't make the acids. Okay. It is also extremely toxic to dogs. If you have xylitol products, gum, toothpaste in your house, you want to keep them well away from your animals. It's very, very toxic to dogs. So just a safety tip reminder for your pets. Make a plan of finding a trusted dental home by first tooth or first birthday, whichever comes first. Asking your medical primary care provider to look at your baby's teeth. Fluoride varnish, silver diamine fluoride, and referrals for urgent care or routine care. First tooth or first birthday. This is an old, this is not new. It's over 30 years old, from the American Academy of Pediatric Dentists. And yet it's so important. Oral health really begins before birth, focusing on nutrition, education, and dental care for pregnant individuals, families, and caregivers. And once established, high-risk cavity habits are really hard to change, especially nursing and bottle feeding babies to sleep. That's a hard habit to change once it's started. Okay, it's a myth that the first dental visit is age 3. Basically, many dentists don't want to see young children, and medical folks many of them have been trained to not look in the mouth. That's changing now. The newer grads actually do look in the mouth, and you'll find more of the integrated care, especially at the public health and community health level, but in private practice, they're completely separate. So if you call an office and say, we don't see kids till they're 3, it doesn't mean they don't need to be seen. It just means that office prefers not to see younger kids. Unfortunately, early childhood caries can result in tooth damage and persistent decay issues for a lifetime, which will ultimately impact both overall health and social economic status. When you imagine the amount of school missed and work missed due to oral problems, pain, kids who are in pain can't study, they don't work well, all the lost time and suffering, it's really all preventable simply by doing some easy to do habits at home. When you have a knowledgeable family dentist, one who's willing to see younger kids, infants, or you have a pediatric dental specialist who will absolutely see infants, they can provide preventive care education, like what you're getting here today. They can provide a positive dental care experiences, and they can support healthy cavity-free smiles for life. All right. I used to treat traumatized adult patients who had been out of the dental care system for 10, 20, 30 years. Many of them have an incidence of a traumatic childhood dental experience, which kept them out of the dental office for decades. So going to some place that can take good care of your child is important, but by its own nature, dental care can be traumatic. And so it's important that we minimize the amount of dental treatment that kids need by preventing disease in the first place. And that's something we can change. In the professional office, fluoride varnish comes with just a little brush. It's just a little liquid. It's kind of honey-like. It gets painted on the teeth. Your medical offices should be providing that for you or asking you about it now. That should be part of their care. Sometimes dentists get upset, like, you put they had the baby done, you put varnish on my baby kind of thing, but most of the dentists aren't even seeing younger kids. So it's kind of a non-issue in reality. And it's important that dentists and physicians work together on that issue, because we want the kids to get fluoride every 6 months. For if they're at low risk. If they're high risk, it's actually every 3 months. If there's active decay going on, silver diamine fluoride is, again, a paint-on liquid that basically there's no drills, you just paint it on. It stops early decay. It basically inactivates those bacteria, and it prevents the decay from progressing. It can be used on all ages, especially patients with limited cooperation, whether it's babies and toddlers, people with disabilities, or elderly folks. All right. The only disadvantage is it turns those teeth black, but oftentimes the teeth that have significant cavities are already turning black. It prevents the disease process from progressing. It buys time until actual dental treatment can be done, or till those teeth erupt if they're baby teeth and they come out, exfoliate. So it stops decay or arrests decay and stops the infection until other dental treatment can be done. Super helpful, can be done in a medical office, but not all medical offices know about it. Not all medical offices can do it, but it would be great if they could. That'd be a great way of integrating healthcare. So just a reminder where we're at. Nutrition, feeding babies upon waking is easy. Eat, activity, sleep, and time for you. No sugary drinks, few sugary foods, reduce grazing with regular sit-down meals, drink plain water in between. After meals, clean and brush the teeth the high chair. After all meals and snacks, adults brush first and use fluoride and xylitol toothpaste for strong teeth and fewer germs. In early care, mindset matters. Tooth healthy care in all early care settings. Low sugar nutrition, yes to whole fruits, yes to water, no to juice. Clean teeth after eating when wiping the face and hands. If we can clean the bottoms after diapering, and we can clean the bottoms and hands after potty, we can clean the hands and the face and the teeth at the table after eating. You'll have fewer germs by avoiding giving germs from the caregiver to the children, as well as by brushing with xylitol, which will result in lower bacteria amounts. You're going to make a plan to find a trusted dental home by first tooth or first birthday, whichever comes first, and ask your medical primary care provider to look at your baby's teeth. Apply fluoride varnish, apply silver diamine fluoride if necessary, and make referrals for urgent care and for routine care by age 1. Just a reminder that whenever you eat and drink, the germs are in there and they're having a party too. So oral health is overall health, and there are 4 steps to a strong and healthy smile. Are you brushing after each meal and snack, drinking water in between? Do you floss all the sides, scrape the germs off your tongue? Awesome. Now your smile is clean. 4 top tips for overall health and for oral health. So we've talked about cavities, but that's not the only part of oral health. And so just really quickly, I'm going to run through what oral health looks like for infants and toddlers. There should be no yeast infections, and those can happen even before the teeth come in. Proper development of the muscles and bones of the face through both nutritive and non-nutritive sucking. Growth and development of the 20 primary or baby teeth, which happen, they erupt between 6 months to 2.5 years. Avoiding dental arch disfiguration that's caused by excessive non-nutritive sucking. Thumbs, pacifiers, blankets, or toys that result in compromised breathing and speech, ineffective chewing, and social teasing when kids have really splayed out teeth or gaps in their teeth because they have used a blanket or a thumb or a toy for comfort, but turned it into a sucking habit. The mouth environment needs to favor remineralization of tooth enamel with abundant and buffering saliva, a balanced oral flora with protective bacteria versus the acid-producing bacteria. The diet needs to also prevent the demineralization of teeth. So diets that are high in acids, whether those are liquid acids, the carbonic acids, acids in drinks, acids in foods, and carbohydrates that allow bacteria to produce acid, we need to minimize that. Maintaining adequate space for eruption of the secondary and adult teeth. So if children lose teeth prematurely, those spaces can close. There can be not enough space for the adult teeth to come in. The adult teeth come in crowded. They're harder to clean. They're already in a bacteria-laden environment, and you can end up getting cavities on the adult teeth. You're basically going to have kids in a mixed dentition stage. And what that means is when at age about 6, the adult teeth start to come in, there's still baby teeth in the mouth until about age 11 or 12. So if the baby teeth have decay and the saliva have the bacteria in it, then any new adult teeth that are erupting are getting erupting into that acidic environment, and they're also going to get decay, and that's how it gets passed on from the baby teeth to the adult teeth. And so baby teeth, keeping them healthy is super important, because if you don't, you won't have healthy adult teeth. Okay. We want to have an awareness and an avoidance of potential trauma, sources of trauma to the face, whether that's domestic violence or car accidents, falls against coffee tables, falling into objects, falls downstairs, falls from strollers, falls from bicycles and tricycles, being hit by objects, and sometimes babies chew electrical cords. So it's really important to keep a lookout for that. And then, of course, in addition to all of that, there's having no cavities, no dental caries in the mouth. So I have a little video for you I made during the pandemic. I hope it will become an earworm for you and remind you to brush baby's teeth. Whoop, let me go back a little bit here. Andrea, do you have the sound muted on your computer?
Give me just a second.
Sure.
If you scroll to the right, you'll see the yeah, that button down there. The volume button.
Scroll to the right.
Should be on.
I see things on the left. Sorry, folks. I'm gonna get here in just a sec.
If you want to give me control, I'll go ahead and work on it.
All right, I'm gonna give you control back to you. Back to you, Andrea.
Baby's teeth do 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 do, brush baby's teeth do 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 do. Each time they eat do 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 do, brush baby's teeth. In the high chair do 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 do, not over there do 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 do. White faces clean do 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 do, brushing routine.
Brush your teeth.
Brush mommy teeth do 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 do, brush daddy teeth do 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 do. Each time you eat do 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 do, brush your teeth. Wash your hands, do 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 do. When you poo, do 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 do. Brush your teeth, do 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 do. When they chew, floss the sides, do 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 do. Scrape your tongue, do 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 do. Water to drink, do 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 do. Choose out all gum. Drink what you want, do 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 do. When you eat food, do 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 do. But in between, do 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 do. Here's what you do. Brush your teeth, do 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 do. Brush your teeth, do 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 do. Each time you eat, do 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 do. Brush your teeth. Brush your teeth.
Next slide. So I'd love to hear from you right now. You can unmute and ask questions. You can put them in the chat. What challenges are you facing keeping your kids cavity free? You can also send me an email with the subject line of cavity free kid question, and I will answer those questions privately as well. But I'm hoping that we can open things up and start answering some questions for folks. And then next slide, please. And that's how you reach me. Thank you so much. It's got to be some questions out there.
I did have one. Sorry, I just kind of jumped in.
Yes.
There's the new like toothbrushing things that's like the whole mouth, kind of like a mouth guard kind of thing. What do you think about those?
I try pretty much every new dental thing that comes on the market. So what is the reason for using them? In other words, is there a particular problem that you're having that you're thinking like, if I use this, it will solve the problem? What is the problem?
For me with my daughter is like the top teeth, like she's really hard like to get the top under her like lip gum. She has four on top, and so it's really hard to get to those, and for her to let me like get where the gums are.
Gotcha. So, and how old is your daughter?
She's a year, just turned a year.
Yes, okay. So one with those mouth guards, they're huge. Okay, they take up a lot of space in the mouth. So if you have a child who's having a hard time letting a small toothbrush in, they're not going to let a big thing like that in their mouth. It's going to be overwhelming. It makes them feel like they're choking, and it could cause them to like get even more reactive to having things put in the mouth. For your daughter, you're saying you can't get under the upper lip. Basically, you want to have her close her mouth together, like go like E, make the sound E, and then you can stick a finger up underneath, lift the gums up, and then get there with your toothbrush. Using a smaller toothbrush, like an infant-sized one, but also using in combination with you have to actually lift her lip up, come from the side, and then move it towards the center. Would that work for you?
Yeah, I've tried that. She just screams like crazy, but yeah, like I think that's part of the hard part with like younger children.
Does she have a
Yeah.
does she have a lip tie? Does she have like a frenum, like a tissue tie that makes her lip very tight against her teeth?
I think she does, because my oldest had it, and like yeah, like the little space between the gum and the lip is pretty tight.
Yeah. So I mean, sometimes those babies have a little bit more difficult nursing and feeding. It can eventually affect, sometimes it can just kind of affect movement and speech, that sort of thing. A lip tie can be released. I recommend using a laser to do that. And that can make it easier to clean as well. But I really think that it's a matter of positioning. Are you doing it in the high chair?
Yeah. Usually I
Okay.
try to like sit her in something because she does have a hard time with like letting me brush it in general. Um, so I've tried like giving it to her and like kind of her having one and then me helping her and a couple of different things to try to fix it. But I usually have her like sitting in something so I can have that support as well.
Yeah, absolutely. Because you want to basically bring her head back against you. And then kind of you can maybe even get a finger on each side and just lift it up. And it's okay if she cries, just to be gentle and just respect the fact that there could be a tissue tie. You're not trying to pull that away or hard, but you should be able to get the lip up just enough. If you want to reach out to me, I'd be happy to Zoom with you sometime and see if I can watch what you're doing and see if make up other specific technique instructions that might be helpful. But I think part of it is just knowing that it's okay to go in, just be gentle, lift that lip and get up underneath there. Make sure you get a size, like a toothbrush that fits well for you. Thank you so much for sharing that. And again, don't hesitate to reach out.
We do have a hand raised.
Jean, I see your hand is raised. Unmute yourself.
Morning. I
Hello.
have two questions. I have twin 3.5-year-olds, and we always let them brush for several minutes and then we come in behind them. And in your program, you kept mentioning parents brush first. So when should we brush? Like when can we change that situation where parents are brushing after the child?
I meant by first, I didn't necessarily mean first. What you're doing is absolutely fine.
Oh, okay.
The kids are playing with the brush, but you're going to go in there and make sure it all gets cleaned.
Oh, yeah.
That's fine. Yeah.
And this might show my age. When I was in school, it was always taught you're brushing for 2 minutes. How important is that? I asked my dentist, and he's like, when they were still one, he's like, as long as you're brushing your teeth for any amount of time, it's good. But when should we start focusing on the 2 minutes? Is that even necessary anymore? Was that just a thing for kids to have a guideline?
The last thing is the things for kids to have a guideline. So what you want to do is you want to brush the germs off the teeth. So with little ones, it literally takes 3 seconds. It's just like, they've got 2 teeth, right? You're done, right? But as they get more teeth, it takes more time. So what I would recommend, especially, how old are your kids again?
They're 3.5.
3.5. So this might be helpful to you. But this is disclosing solution. It's a pink solution. It can get really messy with the younger ones, but it's something you could try for yourself. But the idea is you put a few drops on the tongue, you have them swish with water, and all the germs, which were heretofore invisible, now turn up as pink. Okay, their whole face will be pink as well for a short period of time, but you don't don't do that before an important meeting, if you know what I mean. But the idea is it will show the bacteria germs, like the germ poop on your teeth, and you can brush it off. If you can do that in 30 seconds, great. If you can do that in a minute and a half, great. But what's more important is I want to make sure that you are, let's see, that's good, like getting on the insides of the teeth, right? And if you hold the brush more vertically like this, it's actually easier to get the back teeth rather than trying. You can do it this way, side horizontal. You actually hit the teeth. It's not as great. Hold it more vertically. So you go, ah. I start at the back. I start on one side. I work all the way around. Ah. Then getting the biting surfaces. And then the E, and that the brush is at a 45-degree angle. You're just doing a little wiggle. You're putting it right at the gum line. Brush where the pink meets the white. Brush the gum line, which Santi had just recommended. Like she's saying, I can't get up to the gum line, right? This is really important. Like get to the gum line. She's right on target. That's where you want to get, right? And the same thing. So biting surfaces, and then E, 45-degree angle. When you flip your grip over, go back and brush the area you came this way, and then you flip it and go the other way. So just brush thoroughly, and also brushing thoroughly, like if there's one time a day, like after dinner, that's where you're breaking up the bacteria, a lot of the bacteria, breaking them up every 24 hours is great. The other brushings, like the ones after meal, could actually be faster, quicker. Like again, getting some fluoride and xylitol in it, cleaning it a little bit. It does not need to be as thorough. If you're brushing more frequently, each one doesn't need to be quite as thorough, as long as like one during the day where you really try to get at the gum line and really do a thorough job.
Thank you very much. I appreciate that.
It sounds like you're doing a great job. So congratulations.
My kids love brushing their teeth and they love flossing. And even when they're tired, they're like, Mommy, it's time to floss. So they've got some good skills already.
Yay. It made my mommy heart grow big when my 20-year-old son came back to the house and said, Mom, I need some floss. So those early habits that, they start young, but they're really important. What other challenges are you running into, folks? Ginger.
Hi, Sue.
Hi there.
I work in Connecticut Birth to 3. And I think your video telling people to brush is really awesome. Like it is a bit of an earworm. We know when to do it. I would love a resource that helps me communicate really efficiently to caregivers why it's so important, like some more of the content that you gave us here, but somehow really digestible in like a 4-minute video. Can you make something like that?
I think I probably can.
Okay, that'd be awesome.
So does was it the part that was like the A plus B plus C plus D, like kind of like where the back, is it the why of it?
Kind of like why, like the poop stuff, I think sticks with people, and also the techniques.
Okay.
I'm working with families right before kids turn 3, and one of the questions we asked just on our eligibility, I'm in Connecticut, one of the questions we ask on our eligibility evaluations is like, has your child been to the dentist yet? And a lot of people are like, oh yeah, they're 2. No, they haven't been yet. But just having information from a professional that would help people understand why it's so important would be very helpful.
Do you think like having an infographic with a video embedded would be effective?
Yeah, maybe.
Okay. Just wondering if like seeing it is important as well, or just like you said, just the techniques of how to get in there.
Yeah, something that's in between, like the reminder, brush your teeth after you eat is great, but I kind of want to know like why and how.
Why and how. Okay.
Right.
You got it.
All right, thanks.
And other folks who are listening, is there anything that stood out to you, like in the presentation about the why or about the how, that was surprising, or that caught your attention in a certain way? no one's going to speak out, but I'm going to go to the chat questions. Supporting families and early educators and recognizing the importance of nutrition in terms of oral health. Absolutely. You know, another thing I learned about this week with some folks who work in behavioral health is I've learned that a lot of times kids who have behavior issues are being coached to basically pick a favorite food as a reward. And as a dentist, I would be totally against using food as a reward. I think that is going to be set the kids up for a disaster, especially kids who might be less cooperative and have more dental issues to start with. So I would be very against using especially sweet foods as a reward. Gummy multivitamins, yes, it affects their teeth. You're gonna have to brush after the gummy multivitamin. Those, unless you specifically choose a brand that says it has no sugar. If it has a sugar alcohol, xylitol, sorbitol, mannitol, those are, or stevia, those are tooth friendly. Okay, stevia and xylitol prevents cavities. Stevia doesn't cause cavities. And then you have your mannitol and your sorbitol. Just remember, if you were to eat a lot of those, like if you get jelly beans that have those in them and you eat a lot of them, you will end up with diarrhea and gas. So it's kind of dose dependent. So you don't want to like overuse those products unless you've built up a tolerance to them. So definitely cleaning the teeth after gummy multivitamins, please. User-friendly resource about the impact of non-nutritive sucking on language development. The non-nutritive sucking that I'm talking about is where you end up with kids with teeth that are totally splayed out, or they actually have an open bite, like so they close their back teeth together and there's a gap between your front teeth. I'm not sure what kind of, I'm the dentist, I'm the practical one. Like I'm talking about like the hands-on. We could look for some research together for something like that. But the point is when their teeth don't come together, they can't pronounce words and syllables properly, period. And they're whistling through their teeth, and they look funny, which means kids make fun of them. So as far as, you know, when the teeth are really out of alignment because of a severe habit, that's the problem that I'm talking about. What else, folks? Got more questions? And the same kind of concepts apply to adults too, right? For adults, you can brush teeth after meals, but also you just clean your teeth after meal. That could be brushing with fluoride and xylitol. It could be using a fluoride and xylitol rinse. It could be chewing a xylitol gum. It could be chewing any sugar-free gum, or it could be just rinsing out your mouth out with water. So if you get in that habit of like, oh, I just got my teeth dirty, I just need to clean them, even just rinsing your mouth out with water, which is something that it would be easily incorporated into school-age children as well as for adults, that can make a difference. That idea of the just bringing it to the front of mind, like, oh, my teeth got dirty, I need to clean them. You know, when our hands get dirty, we can see it and we can clean them. We've always been trained to like use the toilet after rinse our hands after we wash our hands after we go to the toilet. But that idea of cleaning your teeth after they get dirty just isn't out there. And when people, again, are sipping at things throughout the day, that can be super dangerous unless that thing is just water. Any other questions you guys can think of? You can also email me or text me personally. Okay, so your baby doesn't close her mouth when sleeping. So that can be, you know, mouth breathing can be an indication of some obstruction in the airway, and that would be definitely something to talk with your pediatrician about, because the mouth breathing does dry out the mouth more. So you're correct as far as a dental higher risk. Having that dry mouth at night is significant, but also wanting to know, like, does she have sinus congestion that might keep her from breathing well? And that's definitely a pediatrician question or a pediatric ENT question, just to make sure the airway is good. When you see kids start to do a lot of mouth breathing, it actually then draws on the sinuses and the formation of the jaws. So they end up with narrow palates, because the palate, which is the roof of the mouth, is the same as the floor of your nose. A high narrow palate means there's less room in the sinuses for breathing in air. And so that whole idea of the like a long drawn out face that can happen when there's habitual mouth breathing. We want babies and children to breathe through their nose. That filters the air, it humidifies the air. So if they're not able to breathe through their nose, that's absolutely a question that you should go to your healthcare provider. Thank you for that. Very important. Anybody else? Well, I want to thank you for the opportunity to speak and give you this information. Please do reach out to me individually if you have any more questions or if there's anything I can help you with. My resource guide has a lot of recommendations for products that I found to be very, very effective, both for adults and for kids. And I even have some tooth fairy recommendations at the end of that. So thank you again, Andrea. Thank you so much.
Yeah, absolutely. Thank you for joining us today. Dr. Sue's contact information will be in the follow-up email along with the recording, the slides, and any other resources that she provided. So thank you so much, everyone.
Got one more question. When is one right time to brush on their own? When you can use disclosing solution and they can show you that they can brush all the pink off. Okay, so basically you have them brush their teeth. They say that they've done a great job. You put the disclosing solution on, you swish it around, you look at their teeth again, you show them these are the spots that you missed. Have them go in with a toothbrush, remove those spots that they missed. If they can go in and do that and they can consistently do it, that is showing that they can brush on their own. Usually happens between age 9 and 12, depending on.
Thank you very much. Thank you.
Yeah, you're welcome.